We often are asked by patients, how do I decide what operation is right for me? And who decides which operation I'm going to have? So first, let me assure you, the patient makes the ultimate decision on which operation we're going to perform. But that decision is not made in a vacuum. It is your partnership with your surgeon that helps you decide what's going to be right for you, and that personal relationship you develop during your consultation. I'm going to paint some broad strokes, though, now about what operation is appropriate for what individual. And we're going to do that by looking at body mass index. So at the lower end of body mass index, we have a body mass index of 30 to say 40. Right? So 30 is the lowest level that you can have an operation. That is the definition of obesity. And between 30 and 40, we basically have two options. Typically, we're going to entertain either the gastric band, especially for those people with a body mass index of 30 to 35, or the sleeve gastrectomy. That would be 35 to 40. Now we have a window of, say, 35 to 50. Certainly patients with a body mass index of 35 who have significant medical problems associated with their obesity, like diabetes or severe hypertension or severe sleep apnea. Typically in that group, we're going to entertain either sleeve gastrectomy or gastric bypass. In our practice, about 60% of people will choose the sleeve gastrectomy, and the remainder are going to choose gastric bypass. Typically, the gastric bypass patients are patients with relatively severe diabetes, or they have significant gastroesophageal reflux. Gastroesophageal reflux is something we have to think about when we're talking about the sleeve gastrectomy. The sleeve gastrectomy can worsen existing reflux. And so patients who have severe reflux, where they need medication every day, or else they really have uncomfortable feelings, we want to have that conversation. It's not a true contraindication where we can't do the operation, but it bears having a significant conversation. Patients who have a body mass index over 50, we're going to lean more heavily on gastric bypass and the duodenal switch as our operations of choice. There is some data emerging that patients who have a body mass index over 50 may not lose as much weight with sleeve gastrectomy, and they might struggle to keep that weight off once they've lost it. So we want to have that conversation and at least introduce the concepts of gastric bypass or duodenal switch, which tend to have more weight loss and better durability of that weight loss over the long term.